Joining us, we're live on Facebook today talking about hand, foot, and mouth disease. We've seen an increase of kids in our community catching the illness, so we've asked Dr. Tiffany Kimbrough to join us today. She's a pediatrician here at Children's Hospital of Richmond at VCU. She's the director of our newborn nursery, and she's also mom to little ones, so she has an interesting perspective. So thank you for joining us today, Dr. Kimbrough. Can we start by talking about just what is hand, foot, and mouth?
Yeah, that's a good question. So hand, foot, and mouth, it's a viral illness, and it basically causes what it describes in the name. So you can get a rash anywhere in the mouth, hands, feet, but sometimes also on the body, in the diaper, underwear area, and sometimes that comes with fever and kind of just generally not feeling very well.
Okay. And have you seen an increase here in your clinics?
Definitely. So a lot of the phone calls that our nurses are getting or the messages that we're getting through the patient portal and then sick visits in the office are related to hand, foot, and mouth. And it makes sense. It's more common in the summertime and early fall, so we're seeing that natural seasonal spike in cases.
Okay. And you've seen it in your house too?
Yes. Unfortunately, my 3-year-old brought it home for everybody, and so it kind of hit each of us one by one.
Yeah. We've had it in my house too, so sounds like we're the norm these days. So it's contagious.
Yes.
How is it spread?
That's a good question. So there's a couple different ways that the disease can be spread. One is through the poop. So good hand washing is one way that you can help prevent it, especially around diaper changes and trips to the bathroom. It can be spread if the rash sometimes will form a little bit of a blister. Sometimes it can be flat, but if it's a blister and that blister ruptures, the fluid inside the blister can spread the virus. And then, like a lot of viruses, it's spread through saliva or through snot. So again, good hand washing, especially if your kiddo's got a runny nose, can help to prevent spread.
Okay. So what are the symptoms? Is it obvious that your child has it?
So it can be either way, actually. There are kids who catch the virus and have 0 symptoms, but they can spread it, or what we call shed the virus, to others. Usually kids under 5 are going to be symptomatic if they catch it. It affects the little ones a little bit more. And it usually starts off with a fever first, and then you slowly see the rash start to develop after that. The fever can be low or high. There's different strains of the virus. It's called Coxsackie. And different strains will cause either a low fever or a high fever. And some strains like to just be in the mouth. Other strains will there's one strain in particular that loves the diaper area, so you get a really bright red, kind of blistery looking rash around the diaper or underwear area that can be quite painful.
Okay. So what's the treatment?
Unfortunately, because it's a virus, we don't have a treatment. There are vaccines that are being studied right now, but none that are available. So mostly we just help the little ones to feel better. The rash can be itchy or painful, so if it's more pain, then we treat with using our Tylenol and our Motrin to help with that, especially if there's a lot of mouth sores, because it makes the kids really not want to eat or drink. And then offering really bland, not spicy, not acidic foods, so going for more of your milk or breastfeeding can help just to make those lesions not hurt as much. If the spots are itchy, we can try a little over-the-counter hydrocortisone cream to help with that, but really just comfort measures, making sure your little one feels safe and secure.
Okay. Is there anything we should avoid doing for our children?
So a lot of times when our kids aren't feeling well, kind of our go-to is juice, and this is the big time where you don't want to give juice. The acid from juice really makes those bumps burn, and then it makes the little ones afraid to drink or eat something again. So really avoiding things that have any acidic content at all, anything spicy, hard, or crunchy. Those crunchy edges can really bump up against the sores and make them feel uncomfortable. While your little one has a fever, or if there are any blisters that have ruptured, that's when they're at highest risk of spreading the disease to others. So staying home, not going out to the grocery store, keeping them home and comfortable is important to help reduce the spread to other people.
Okay. Is it dangerous?
So usually not. Usually this is a very benign or kind of self-limited disease. So it lasts for 3 to 7 days. The kids would gradually improve. The main complication that can happen is dehydration. So for those little ones that have mostly the mouth sores and they're afraid to eat or drink, they can get really behind on their fluids, especially if there's a fever. Very rarely the disease can cause meningitis or an infection around the brain. So parents are going to be looking for high fever, headache, neck pain, lethargy, not really waking up to eat and drink. Those are going to be reasons to go to the emergency room.
Okay. You mentioned, 3 to 7 days, you kind of have to wait for it to work itself out of the system. How long do we need to keep children out of daycare, summer camp, play dates, things like that?
So we recommend parents to keep their kids home at least 24 hours after their last fever without any pain meds. So if you're still having to give Tylenol and Motrin around the clock, then that can mask the fever. And then if there's been a little blister that's opened up, we wait till that blister is crusted over. Unfortunately, kids can shed the virus for several weeks even after they're better, so we don't say keep your child home for 6 weeks after they've had the illness. That would be unreasonable. But kids who are totally healthy can shed it too. So unfortunately, there's not a great 100% way to prevent it from spreading. It tends to cluster, around daycares, around camps, around schools where a lot of kids are together and sharing all their toys. Frequent hand washing, rubbing the surfaces, especially toys that kids are playing with often, cleaning those things can help. And then washing your hands, especially after diaper changes or toileting, helping the little ones can help reduce the spread.
Okay. Now you talked about usually it's the kids 5 and under who are showing the symptoms, but adults can catch it too?
Yes. So rarely adults can get the hand, foot, and mouth, and it tends to be a little bit more severe in the symptoms for adults who catch it. So it tends to look a little bit more like flu with muscle aches, headaches, fevers, sometimes some joint pain. It can have some nausea and vomiting associated with it as well. And then the rash can pop up similarly in the mouth, hands, feet, or in the underwear region.
Okay. So at what point should a parent be concerned, or should they bring a child in to see the pediatrician?
Especially if they're worried that their little one isn't getting enough to eat and drink. And kind of the marker I look for is how many wet diapers or how many trips to the bathroom they're making. So if it's been more than 8 hours and there hasn't been a good wet diaper, your little one hasn't had to go to the bathroom, or they wake up in the morning and they don't have to pee right away, that's a sign to me that they're not getting enough fluid. And then those rare complications of, meningitis, I'd be looking for a kiddo with severe headache who really, doesn't want to get out of bed, more so than what you would expect for just not feeling very well. Anyone complaining of neck pain. And then if the parent just doesn't feel right, parents have a sixth sense that is really important that they should tune into. So if just something doesn't feel right to them, I always want to hear from my parents.
Okay. Thank you very much. I know, a lot of folks in our community are facing this, so thanks for answering our questions. And if you have additional questions that we haven't covered today, you can drop them in the comments and we will message you back and try to make sure we get answers to you. So thanks for joining us, and thank you, Dr. Kimbrough.
Yeah, thanks so much.